So good morning, good afternoon, everyone. This is Judy Torode from UICC. We're just waiting for a couple of people to actually get actively dialed in, and then we will kick off. I don't know if you can see me on your webcam. I can't see the other.
Hi, I'm getting the phone right now.
Hello, thank you for joining us. I didn't quite hear your name, but I certainly detected that you've joined, so thank you for that.
Did you want us to use our webcam?
Only if you...
Hi, Julie. This is Doug from NCI. I can see you.
Hi, Doug.
Hi.
Hello. Hey.
Okay, everyone, so thank you for joining us, and Happy New Year from UICC and the various partners around the globe on the International Cancer Control Partnership. I'd like to welcome you to this tutorial, which is a collaboration with the World Health Organization and the International Cancer Partners to look at doing a global review of the National Cancer Control Plans and NCD plans that are in the public domain. So in this session today, we'd like to walk you through the review process, but as a context, I'd like to give you just the opportunity that 2018 is offering us, which also gives you a perspective on why we're doing this review now and why we'd like to get the review.
Hi, this is Evangelia Razis from Greece.
Thank you for joining us. So the agenda today is that I will kick off just with a few contextual comments, and then I'll hand over to Brenda Kostelecky from the National Cancer Institute Centre for Global Health to just sort of remind us all of the key principles of cancer planning.
Anna's over in her office, so she would.
The majority of the time will be dedicated to Ilbawi from the WHO to walk us through the methodology that we'll all be taking on this review, and sort of giving us a view of the types of questions and issues that will be confronted as we start this project. So you can imagine that it sounds quite ambitious to review all the global plans. There are over 100 countries now with plans, NCD plans and cancer plans. But it's also about the time that we need to start pushing a slightly different advocacy message, whereas before we were happy to be encouraging countries to have a plan. We now want to really challenge countries to have the best plan they can for the country and to, of course, be actively implementing this plan. So following the Cancer Resolution in May last year, we really feel the time is right to re-emphasize the recommendations in that resolution and the opportunities that the NCD agenda are affording us to really push cancer plans in 2018. So we're hoping to get this review done in a 3-month period, really taking the data from the review in March to be able to develop both a useful commentary on what we can learn from the current cancer plans forward to the September meeting, where the UN comes together at the highest level, heads of state, heads of government, to talk about progress on non-communicable diseases. So we obviously want cancer to have a good share of voice in that conversation, and so presenting a new map and our hopefully very positive commentary around what we can learn thus far for pointing countries in the right direction for their investments is where we want to go. So I hope that you're excited about this. I'd like to certainly take this moment to thank you all for committing to be part of this project. It's really only possible because everyone is making these big commitments, time and energy, and we thank you in advance for that. So with looking at time, I'll hand over to Brenda to walk us through a short introduction to cancer plans. Thanks, Brenda.
Sure. Can you hear me, Julie?
Loud and clear, Brenda.
Okay, great. I'm not sure how to display the slides. Oh, there. Can you see the slides?
Yeah.
Okay, great. So I was asked just to give a very short overview of cancer control planning core elements, and I know that a lot of you are familiar with cancer control plans, and so this is going to be really brief. But I wanted to start with a definition of a cancer control plan, because a lot of times we talk about cancer control strategies, cancer control policies relatively interchangeably. And so for our purposes here, the cancer control plan is a strategic plan to control cancer based on the country's cancer burden, risk factor burden, and resources in the context of the culture and healthcare system of the country. And this is a nice definition that I've stolen from UICC. In general, one of the reasons that we advocate for developing plans is because a goal without a plan is just a wish. So in emphasizing some of the benefits of an NCCP, they can be used to increase the use of evidence to guide policy and program, maximize the use of resources, help communicate cancer challenges better, the needs, and the path forward, and thereby increase financial, political, and social support, help coordinate efforts. As you all know, cancer is an incredibly complex health area, and that coordination is really important. Help to ensure accountability for making sure people do what they say they're going to do, and then improve health outcomes ultimately. We see common challenges in a lot of countries, and this is particularly the case in low and middle income countries, but we see these challenges in high income countries as well. So support and funding is always a challenge, both for cancer control, for cancer planning itself. A lot of times there's a lack of funding to develop the plan, which does take some resources, and then for research to inform the plan. And there is often a challenge in terms of infrastructure and resource, especially around access to data, the data quality, facilities, equipment, workforce, and a lot of those related needs. There's often competing priorities, infectious disease, maternal child health, traffic accidents, you name it, and then that's just the health arena. So there's always competing priorities. And then cultural norms and context, and this can vary even quite substantially even within countries, but certainly between countries. So all of this really underlines the importance of cancer planning to make sure that you're working through these challenges systematically. We see cancer control as really a whole of society challenge. It really has to be embraced by government, civil society, the private sector, professionals, patients, the public, caretakers. Interventions really need to take into account the social determinants of health. Again, reiterating the need to actually engage partners in the health sector, outside of the health sector. And government is one important player in this, but is not the only important player. So certainly in all policies related to tobacco control, for instance, involves a lot more than the government and a lot more than a single government ministry. So we see the NCCP process and outcomes is really coming hand in hand. So you can't really have the outcomes without getting the process right. And the process involves cohesive partnerships, making sure that evidence is incorporated, developing consensus on the path forward, ensuring accountability for players to play their part, good communication, and most important, monitoring and evaluation to understand whether you're on track with what you intend to achieve. And then the outcomes, you can see a plan itself as one of the outcomes, but that's not the ultimate outcome. Ultimately, you want to see that plan implemented, and you want to improve health, particularly in cancer prevention and control in this case. So we like to stress partnerships as one key element in the foundational and the process area of cancer planning. It can be used to combine resources to really maximize support, promote coordination, increase the comprehensiveness so you don't have gaping holes in the plan, reducing disparities, and enhancing sustainability. Some of the essential elements of a national cancer control plan, and I know that WHO has set out an 80-point scheme for looking at this much more comprehensively, but sort of the broad outline of that is really that a plan outlines the vision and mission. It articulates clear goals, objectives, and strategies. It uses available data and evidence to identify the needs and guide those strategies. It sets up clear monitoring and evaluation of the plan, and it also outlines a plan for financing or developing additional resources and revenue, as well as leveraging existing resources. One of the things that we tend to look for when we're looking at quality of a national cancer control plan is some of the process, as much as that can be extracted from the text of the plan. Was it developed by a multi-stakeholder, multi-level team? Does that include groups like government, civil society, academia, and non-health sectors? Does it take into account the unique country context and social determinants of health? Does it communicate clearly to its intended audiences, including the policymakers, but not limited to just policymakers? And is there a plan for it being implemented and measured? So that's sort of my very brief overview of cancer control planning, and I'll leave it at that, and I'll hand it over. I think I'm handing it over to Andre now to really talk about how we're going to go about looking at this in the context of this global landscape plan, scan.
Excellent. Thanks so much, Brenda. And before beginning, I just want to express my gratitude for the great momentum here in the ICCP community to pick up this project. It really is a priority as we look at the landscape within the cancer community and also amongst governments as expressed in the Cancer Resolution. So for the next half hour or so, what I'll focus on are these four elements, but my hope is that we can have a bit of a discussion, because I'm sure there are questions that will come up during this introduction, and in the process of doing so, please feel free either to raise a hand and do participant feedback through the ReadyTalk platform, or just go ahead and interrupt. I would be much happier for this to be a discussion. So to begin with the context of why now and how did we get here, I think Julie and Brenda set the stage nicely. But just to reiterate some of the specific elements here at WHO that have really focused our attention on cancer control plans as a priority. As most, if not all of you know, last year was a landmark year for cancer, in which there was a cancer resolution which was the first time in over a decade. And when we look at what the priorities within the resolution are, we see that cancer control plans really do feature quite prominently. Within the resolution, another reason we see great interest in this project is because we are intended to work together. The WHO specifically requested to work with partners to help countries in national cancer control planning. As many also know, there was a cancer resolution in 2005, and one of the heavy focuses in the 2005 resolution was to tell countries make a plan. Cancer plans must be a priority, and as you can see looking at the number of countries that do have plans, it increased significantly between 2000 and 2015, from about 50% in 2000 to nearly 87% in 2015. But the problem, as Julie and Brenda alluded to, is that most of these documents are not operational. These are documents that, as we all in this group have done, when we review them, we see that there are certain gaps within the plan themselves. There are elements that may be missing. There are elements that were taken from a different plan that may not be appropriate. And also, as Brenda mentioned, there are often major gaps in how to finance the plans, how to implement, and how to monitor them. So we started by using the Cancer Resolution as our reference point for how we wanted to move forward. Countries, again, within the resolution are told that they not only need to develop, but focus now on implementation of plans. So what is it exactly that we can do to help countries with implementation? But before getting into some of the details, this slide, I know some of you have seen this before, but I think really highlights how important plans are. The OECD in 2013 did a review of why are there differences in breast cancer outcomes between the OECD countries. And they looked at over 15 variables that could explain that variation. For example, why are outcomes better in the US compared to Latvia? And when they tried to identify what were the variables, they found that the presence of a strong national cancer control plan was in fact one of the strongest predictors of whether or not a country had successful breast cancer outcomes. So the data are now clear to say cancer control plans must be a priority in all countries in all settings. This data from the WHO in 2015 show that while countries do have plans, many of, in fact, do not have plans that are operational. And this is the gap that we're trying to fill. How can we create plans that are operational and effective? And if we look at it in a stepwise approach, we see that of countries that have plans, about a third are plans that are not operational or implemented in any meaningful ways. Most of them do not have plans that have explicit funding or resource allocation to them. Most plans are also not founded on the highest quality data, given data gaps that exist. So as we sat around the table and we've had these conversations internally and externally, the first question is, well, what is a good plan and how can we help countries decide how to develop a plan and how to implement a plan? While it seems straightforward, unfortunately, there are no best practices that have been well articulated in what should a cancer plan have. And to reiterate something that Brenda said, it often starts with even a inconsistencies as to how we define what a plan is. We see that countries develop plans, they develop strategies, they develop policies, and develop programs. But what really is it that a country needs, and how can we help them implement it? There are some groups that have done this work before. As you can see in this slide, the CDC, UICC, NCI, WHO, IEA, IARC have all produced some background documents on what is a plan supposed to entail, but not to the extent that it will help a country draft the plan and then operationalize. So when we spend our time reviewing countries' plans, governments send their plans to the WHO and partners, and they say, please review this plan. Our hope was to develop a consensus as to what is a good plan. In order to do that, a small group of us, and for this I'd like to acknowledge May Yap, who was a key partner in the original brainstorming of this project, we sat together and said, okay, how do we know what a good plan is? So we did a landscaping of what are all guidance documents about what should be in a cancer control plan. We found about 14 guidance documents, and you can see them listed on the screen right. All of them described elements that should be in a plan, but didn't itemize it in a way that we thought could help countries operationalize it. So what we did is we took those 14 reference documents and we organized them into major domains. The major domains were across the cancer continuum, and an additional way of structuring it through health system building blocks to make sure that we really did cover all key elements of a cancer plan. And then from those 14 guidance documents, we broke down the specific elements into what we call topics, and I'll show you what the topics look like later. But then we were able to create an Excel file that was about 20 rows, 20 columns and about 100 rows, all with auto-populated data from what each of these 14 documents had as it pertained to each topic. From there, we were able to then structure which are the topics that were most frequently referenced. So, for example, in those 14 reference documents, one may say, does the plan have a approach to cancer genetics? If it only appeared in one of those 14 guidance documents, it was a lower priority. If all the 14 documents said a good cancer plan should have a start date, then we would prioritize those that were most frequent, and we also prioritize those that had WHO or other UN agency guidance. Once we had this itemized list, we then shared it with internal and external partners. As some of you know, there's a team dedicated at WHO to actually developing health plans, not just cancer plans, but plans across the continuum, HIV/AIDS plans, maternal health plans, et cetera, et cetera. And we also sat with them and said, can you review with us these elements of plans and tell us how should we give countries guidance on what a plan should include? And from that, we narrowed the list of about 150 to 80 specific topics. And this is just a small element of one of the specific domains. This domain is the general overview. The first column you can see is the domain that we had described. The second column is the number of documents that cited this specific element, this specific topic. The third and fourth are the topics and a description of the topic based on the best summary available from any of those 14 documents. The next is the checklist item, our way of categorizing it into 80 points so we didn't have too long of terms. And the last was to then consolidate this into a Google form. And if my share screen works, I'll be able to show you exactly how this Google form works. But I did a snapshot just to be sure you could see. What it effectively allowed us to do are checkboxes. So here's the beginning of a checklist. We would ask how many documents were analyzed for the specific country. Is it an NCCP or is it associated with an NCD plan? Are there country-specific goals, targets, etc.? And this was an 80-point questionnaire. What we found are certain key lessons. Our group of about 5 people reviewed 30 countries' total plan. The first thing that we found is it's tricky to say whether or not a plan has something or does not have something, because it's subject to interpretation. In order to validate our methodology, what we did was we had 2 different readers interpret the results of one country, and we saw how many inconsistencies there were. And we found that there were about 20% discordance in how a specific topic was assessed between those 2 reviewers. So we decided, based on that initial piloting, that we wanted all countries to have double readers and to also have a 3rd reviewer reconcile any discrepancies that exist between those 2 original reviewers. The other thing that we found was that it's quite cumbersome, because some of these plans, as you can imagine, are 100 pages long, and if a country has a National Cancer Control Plan, plus an NCD plan, plus a tobacco plan, all of these we intended to review. So we found it was helpful to start creating key search terms to make sure that at the minimum we would look for these specific terms as a way to say whether or not the country had included that key element. So what we would do is start with using the key terms, do the full analysis, and then once we've done the full analysis, go back through and skim through the plan once more just to make sure we weren't missing any elements. And by doing this level of redundancy, we were able to reconcile some of the discordance rates that we had initially. Another question that came up very early in the process is, well, are we talking about National Cancer Control Plans? Are we talking about NCD plans? Are we talking about both? And what we decided is that it would be unfair to penalize a country for not having a cancer control plan if their NCD plan was quite comprehensive. Because the current WHO positioning is, as long as the National Health Plan has a strong element of cancer plan, then the need for specific elements of cancer or even cervical cancer as a subset wouldn't be required, as long as the key elements were mentioned in a document. What this meant is that it required reviewing of 2, 3, or sometimes even 4 documents to assess whether or not a specific topic appropriately appeared within the national health strategies. So what we discovered is the best approach is to have most topics specifically ask the question, does this appear anywhere in the guidance document? And then for certain specific questions, we wanted to know, did it appear in the NCD plan, in the cancer plan if it exists, or in both? And the reason for this additional level of questioning is because while some believe that an NCD plan can be comprehensive enough for a good cancer approach for a country, what we find is that most countries that have NCD plans often have significant gaps in cancer management strategies. So another purpose of this review is to answer the question, do countries have strong plans in cancer if they don't in fact have a cancer-specific plan? So in order to answer that question more robustly, within the questionnaire we have specific questions that ask, is this in the NCD plan, is this in the cancer plan, or is this in both? A third lesson that we learned is that some of the questions needed to be restructured. Some of the topics weren't clear, some of the search terms weren't appropriate, and we were able to improve our strategy having done a pilot of about 30 countries. Another issue we ran into was that many countries were, of course, not in English. We were able to do some of these through second language skills of our group, but some of these also required an online translation. Julie and I were discussing earlier, it seems that amongst all the experts we have on the call here, we have the reassurance of most languages being covered. So we're very grateful for this, because it is significantly preferred to review it in an original language than to do it through an online translation. We found the online translations adequate, but not optimal. And finally, yes, this is time consuming. We found that a country reviewing a country's plans could be anywhere from 45 minutes to about 2 hours. But in reviewing 30 countries, we found some incredibly fascinating results. And I didn't put too many of the results in here. I'm happy to raise some of the conclusions and findings that we had if some on the call would want to discuss that further. But just to reassure you that these are incredibly valuable reviews that are being done. Because what we're trying to do is consolidate best practices, review where countries are, and really help countries develop plans that are appropriate for their context, that are implementable, that can be tracked over time, and that can also be financed. So while 45 minutes to 2 hours per country does sound intensive, we have a very diverse group of experts on the call and willing to support this project. And with that support, we think we can finish this project in a 3-month window. So what are the next steps? As Julie mentioned, our intent is to do a trial for each of the agreed reviewers to analyze one country in the next 1 to 2 weeks. And that in the process of doing that, we will send to you the specific topic wording and search strategy as well as the Google form in the next week. And that as soon as each reviewer has done their initial one-country review, we'll plan to convene the group to discuss points further. Here's a brief how-to, and then if this, just as a background, and then if it works, I'll also show you using shared screen exactly how we did our strategies in the past. So here's what the Google form looks like. It's a specific question related to occupational carcinogens. In relation to occupational carcinogens, is there any plan to track, monitor, or address a specific occupational carcinogen? So in parentheses is what we usually did for the search term. If it's a full word, then the full word appears. If it's a word that we wanted to stop at a partial term, for example, if we had in the last term INHAL, could be inhale, inhalation. We didn't want to pick one of those two, so we used a truncated portion of the word to make sure it was an inclusive strategy. So in parentheses, you see the strategy that was being used to analyze or to search within the multiple plans whether or not that term exists. And the question response was yes, no, no, but it's mentioned, and not in any meaningful way, just to say we want to address occupational carcinogens, or no, it is not mentioned at all. And each of these have a different scoring system. As you can see, there's a similar question for environmental carcinogens. And in each of these, we also have an associated description in the Word document that helps in case you want to know what is the difference between an occupational carcinogen and an environmental carcinogen. Those questions can also be answered in the reference document. Here's another example of a how-to. Does the cancer strategy or separate policy document acknowledge hepatitis B vaccination? Here again you see the search term, and it's a yes or no. And the next question is we ask whether or not the recommended strategies were consistent with WHO guidance. Because what we were finding in our reviews is that many countries did have, for example, HPV vaccination or breast cancer screening. But we found that a large percentage of countries were not adhering to what we would consider global best practice. So within our review, we also wanted to identify how many countries were able to actually adhere to those global best practices. And here's an example of how we placed the WHO guidance beneath the prompt to help facilitate an appropriate answer of that question. So again, to discuss the next steps, in the next 1 to 2 weeks, we hope that each of the reviewers will be able to review one country, as Yannick will explain that process moving forward. In that, we will send to you the how-to document, which I will show you shortly, in the next 2 to 3 days with a summary of the topics, the search terms and descriptions of those topics. And then we'll also update the Google Forms by Monday the latest so that you can input your responses directly into Google Forms. We want you not only to do the assessment of the country, but also equally, if not more importantly, we want some feedback on which topics, for example, which prompts need clarification, which ones may be redundant. Are there any strategies or recommendations that you would have for the group to improve efficiency or to avoid redundancy? Then we'll reconvene, and when we do, we will then break ourselves into 3 groups. Those that will be the primary reviewers of countries and their plans, those that will be reconcilers for countries, for responses that are discordant, So if one person says the HPV vaccination strategy is inconsistent with WHO, a different reviewer says that it is consistent with WHO, a third reviewer will reconcile that discrepancy. And then, of course, we also invite any on this call to be involved in the data analysis. As you can imagine, this will be a very rich database of fascinating country data that we'll then be able to interpret as a group and start sharing those findings with countries, with partners, so that we can improve the cancer plans for countries moving forward. I've listed here the 2 email addresses. I think Yannick will also mention how to contact either the Secretariat through the NCCP review. I've also listed my email address. Please feel free to email or call if there are any questions or concerns that arise. So I'll pause here. Perhaps we can use this opportunity for a brief discussion.
So thank you, Andre. So we can take question right now. The thing we kindly ask to everybody to raise the hand before asking any question to Andre or Brenda. Thank you. So Andre, you were crystal clear, so it seems that you have no questions.
Well, thank you, Yannick. I'm not sure it was exactly crystal clear, but perhaps I can try to share the screen and let's see if we can go through one of these, the 2 forms together. So this is the first one that we will send out. This is what we're calling the original template. So you can see here, there will be some background information, and we start here with the general overview as the domain. This row again is the number of overall plans that had recommended the inclusion of this topic. The topic here is plans, the plan objective or scope. It's broken down into 3 key elements. And then the first question is the NCCP a standalone document? Are there any additional cancer, etc.? Are there goals specified? Is there a cancer goal specified, etc.? And here are the search terms that would be used. So this is one of the 2 documents that we will send. This document itself we use as a reference. So please, if you have concerns in your review, please note them here using either standard track changes, or you can use review and put a comment question here, discuss further, etc. And as you can see from this long list, we have here the domain of prevention. Questions about tobacco control. Here is the topic. Here is the specific elements, and then in the last one is the specific question, the search term that should be used. For example, for occupational carcinogens, after our initial review, we thought we should include silicon or dust, environmental, chemical. These were the search terms that we thought were the most appropriate. So please, in your review, comment on these if you feel that there's something that's not clear or something that should be changed. Once that's done, the next thing you can do is I can show you here what a country review would look like. So here I pulled up for Ethiopia. You see that they have an NCD plan and they have a cancer control plan. So we would start here and say, what country are you reviewing? Ethiopia. Here, this is Google form here. How many documents were analyzed? 2. Is the NCP a standalone? Yes. This is the National Cancer Control Plan. It's a standalone. Are there any indicators? So here I see goal, target, and indicator. Do a Control F function, hit goal, nothing found there. Target, nothing. Indicator. So then we try also here, indicator. So it shows one here. That's not an appropriate response. Nothing there. So then target. So go to national targets for prevention and control of NCDs. We see that there are specific national targets that talk about the WHO 9 voluntary targets. So yes, there is an NCD goal. And we would look through, read here, is there a cancer-specific one? If it's yes, then yes to both. And then time frame, 2016, etc. So the way we found it easiest is to put the 2 documents next to each other to use the Control F function. And then at the end, suppose I say, well, that's strange. I don't know why there aren't any targets here. In this situation, it may just be a loading problem. But you'll find that in your review, oftentimes you do go through each page, and you may identify that perhaps they didn't specifically use the word target, but it mentions goals somewhere. And this is where we start to see some issues with discordance. So suppose in your review, looking at some of the details, you say, okay, in fact, there are targets, then again, we would, the yes to both of the above would be the appropriate response here. You can see that there are about 12 pages, each of them relating to one of the domains. This one here is prevention. I can just click, show you. In case there's one that's not appropriately completed, it will flag it for you. And then here again, you see the prevention. These questions here will correspond with these topics, items, these specific questions, and these search terms. So I hope that provides a little more clarification, and I'll pause for any questions.
Can I ask you just one thing, please?
Yes, Supriya, this is you.
Yes, Munir, we'll let us speak.
Hi, Andre.
We have Supriya.
Hello.
Yeah.
Hello.
So Andre, I just have a question that most of the cancer care plans, like for example, I know for India, there is an operational framework, but then for many things, there is no way to implement those things. For example, screening. And I guess that the implementation framework for any of the national cancer care plans is directly linked to the first, the political intent, and second thing is the finances that are available. So is there a way to separately assess the efficiency of NCCPs for high-income LMICs and LICs? Because a major deterrent is lack of dedicated funding, even though we have everything on pen and paper. So how do we assess? Because that financial impact is going to be very different according to the money that is already allocated.
Yes, thank you. That's an excellent, excellent question. So we try to capture some of this by including in one of the domains finance. So we specifically ask questions, are resources specified? Is there a mechanism of prioritization? Is a specific cost mentioned? Looking at elements of cost and budget. Your points are extremely well noted. The focus for us is specifically the content of the plan itself. And the plan, when we did our review, we would include in our review any operational plan that was associated with the cancer policy, so that we were giving countries credit for as many documents as they had available. The challenge that we all have as a group is, where do we draw the line? What we had initially decided was we have our internal WHO database of plans and also ICCP as well. What we want to do before we start our formal launch is to populate the ICCP with as many plans as possible, so that we know if a country has an operational plan that's in the public domain, it can also be included in the review. That's the first point. The second point about the financing of the plans, we don't actually look at government budgets themselves, but within the plan, we include it as one of the core domains, finance, and we also include it as one of the domains, monitoring and implementation. So there's some here about, here we are, monitoring and evaluation of the implemented plan. Is there a plan? Is there a detailed mechanism? Is there an accountability? And other elements of health information systems. Please do review that in detail. If you think that more points should be added, we would welcome it, because I agree with you entirely. This is a major gap in actually translating policy plans into action.
Thank you.
Thank you, Andre. Do you have other examples to give?
Other examples, I'm sorry, Yannick, of?
Well, if you want to go ahead with the presentation.
No. This was the end of it. I thought.
Yeah. Okay. Perfect.
The rest we can see if any questions or concerns, and you can then discuss our next steps moving forward.
Yeah.
Andre, this is Louis Fox, MD Anderson. If I could ask a question.
Yes,
yes,
please go ahead.
Thank For the initial group of plans you reviewed, I believe you said 30 or so, was any opportunity offered to the countries that developed the plans to provide some feedback or to look at the reviews to try to get an idea of what they were thinking of this?
So this is also a very important point. We have had conversations with representatives from countries, but did not specifically about government. And there are a few reasons why this was the case. This is a part of a much larger body of work. I think some of us group have discussed before that when we look at cancer and policies, we know that there are gaps in the actual content of the plans, the implementation, the financing, and the monitoring of plans. So what we want to do is use this as a rapid review just to show where countries are. Our intent is not to say this is the final 80-point checklist. We want to avoid that type of language, but just to do a snapshot of where countries are. And then once we have that, we can start internally developing within ICCP a better sense of, okay, what do we really think are the key priorities? And can we put together what we would consider a globally validated checklist of how to develop a plan? And that would be the point in which we engage in government. If I'm understanding your question, there's also an additional important element you raised, which is we should also be with countries whether or not there are plans that are not on ICCP that we have not reviewed, or government policies that we did not review in our initial capture. And this again, I think, is where do we draw the boundaries? This is an important point for group discussion, so I'd be very happy to hear your thoughts. What the initial approach was, as you know quite well, is to send out just a notice to different global partners. If you're aware of any plans, please update them so that we are confident that we have the most up-to-date, most debate. But whether or not a better approach would be to reach directly to the government, maybe you're right. I don't know. Perhaps we can discuss that as
I guess it's just the question of kind of what we're going to do with the results of all the reviews. If this is just for our own edification and analysis, or if this is something we're going to make public, or I guess want to be sure we're not putting countries in a position where they might feel like we're criticizing their efforts or something of this sort. I think it's potentially a huge opportunity for them to look at what other similar countries are doing, what are their peer countries doing, try to use this as a normative sort of exercise that they could learn from. I guess I have a little concern. Be careful how this is presented to the countries or to external entities once we're done with all this. What's sort of your vision on how that might roll out?
Yeah, that's also very relevant. As you know, WHO and other partners have been in difficult positions when they try to grade countries. And this is a situation in which we really do want to avoid any grading to say country X did better than country Y. Because as you mentioned, the reliable normative guidance in the exact composition of a plan still isn't there. What we intend to do is to use this as the foundation of a discussion as to what are some lessons that we can learn. How can we correlate the composition of the plan with the delivery of services or with changes over time? Because this is really, the way we see it is more of a snapshot. Avoiding country X has a score of 80 and country Y has a score of 60. What we can do is say, when we look at a country that has a good breast cancer early detection strategy, we see that in this low-income country, they propose improved diagnosis, while in another country, they're proposing breast cancer screening for women 20 to 40. And show exactly where our gap are. So that country is doing breast cancer screening for women 40. That's an need to intervene and say, as ICCP, we have the normative guidance to say breast cancer screening for 20 to 40 would be consistent with best practice. So we can use this opportunity for bilateral engagement with countries through conversation, but use it for global advocacy and promotion of best practices.
Okay, thank you.
Thank you, Andre. We have a question from Supriya regarding the tobacco taxation plan and if it could be included as a document to check.
Yeah, that's an incredibly important point. So we do include tobacco taxation in one of the topics that is queried within our 80 points. We don't specifically look at the laws that may be outside of National Cancer Control Plans or NCD plans to ensure that they're included. But in our review, we did include tobacco strategies, which often do mention tobacco laws. So it is one of the 80 points. We are confident that we do capture it in most countries where it's being trialed or enacted.
Evangelia, we have a question from Evangelia, Andre.
Mm-hmm.
Please
yes,
go ahead.
I wanted to ask whether funding is in any way related to our reviews. So in other words, if, for example, we find out that a country has a very good plan that has very good points to be evaluated and is being funded, will their ability to sort of document results end up having an impact on whether they get funding to implement further cancer control projects?
Yeah, that's maybe outside of the scope of exactly what we're doing. I think it's a very relevant point to raise, though. What the link to this review to implementation, I would suggest, would be through ICCP developing a voice for how we can support countries in identifying priority programs and actions that ICCP can also facilitate through a larger stakeholder community. Right now, we don't have any mechanisms or means to motivate governments to fund specific programs or plans, but I do think this could be an opportunity for us to help countries identify priorities and perhaps approach donors to say, yes, this strategy is consistent with best practice and therefore is more likely to receive funding.
Okay, thank you.
We have a question from Munir. Munir, please, go ahead.
Munir, I'm sorry. Yeah, perhaps Munir, you may be muted.
Yeah, no.
Yeah. I just can answer point. One of them is that these programs were developed by different countries, and I know from my communication with different people that most committees actually they have the WHO or another organization copy paste from the internet, and they just made few changes here and there. I strongly recommend that you send these forms and these feedback to review for individual countries, as my colleague mentioned previously, and leave them to have the homework by themselves to modify their own program based on the review points. That's one point. Okay?
I'm sorry, Munir, I lost you for a second there. Can you repeat that?
I'm saying that several countries actually adopted their own programs from WHO or from another international organization's guidelines with small changes here and there. So I think it's good to improve their skills of developing their programs by sending them the feedback that you have, and then they can make the review for their own, so they can modify their program according to these points that you have in the review.
Yes, I think you're very right on that. Sorry, go ahead with the second point, and then I can respond.
It's okay. Let's go one point by one. What do you think about this point?
So I think you're absolutely right. I think it's not only for WHO, though. It would be helpful for us as the cancer community, WHO, ICCP, and other global experts to start consolidating recommendations, because what we see often in countries is that you're absolutely right. They'll take a plan from a neighboring country, cut, copy, and paste, receive input from a limited number of experts, and end with a result plan that isn't implementable and isn't based on best practice. If we can start defining what are the key elements of a plan, we can help countries formulate it in their own right, and ideally we can also come up with mechanisms for how to engage an appropriate multi-sectoral representation in the development of a plan, and also equally important is the identification of data elements that can help inform the plan itself as well.
It's for example, it's one of the issues that face actually globally, actually in developing countries, not in developing countries, is applying evidence-based medicine and health economics and their plans for resource reallocation. And I think it's maybe good to have some tools to some countries where, or to some regions, where you sit with people there over 2 days and review their cancer control and listen to the priorities there, then you can develop something there. I think it's maybe going there to the grounds in these countries would really help more than sending them a feedback from long distance and without understanding the facts and the situation in these individual countries. Another point that I have seen in some countries, in developing countries, also the people involved in the cancer control or non-communicable disease control, unfortunately, in many cases, they are not really well trained to draw national guidelines, or just even they are not, unfortunately, not the right people are taking the right positions in these countries, and unfortunately, this goes in a major that we have lack of progress in many countries in this.
Munir, thank you for two more very important points. I would suggest that we should definitely continue this conversation as we look at how to analyze the data, because your points, I think, will help our group translate our findings into something very relevant. And I think Louis also mentioned that as well. We don't just want this to be a score. We want this to start a dialogue about who should be involved in good plan development, in plan implementation. And your points are very relevant to us making sure that this data can be interpreted in a meaningful way. So let us please continue this conversation in the data analysis group. And again, all are welcome to participate in that also.
Andre, can we take a last question from Verna, please?
Yes, absolutely. Hi, Verna.
Verna?
I'm sorry, we can't hear you.
I suggest to move forward, and Verna, you can just send us an email with your question in case, and we will try to answer as soon as we can. Andre, do you have anything to add?
No, just again to express my gratitude to the group. We're very excited to see the next steps, and the first 30-country review was quite fruitful. To think of what will happen with this group consensus in a review of all countries globally, it's really an encouraging and exciting time. So thank you again to all.
So thank you, Andre. These are the last, we say, 2 minutes regarding the general logistics, because I'm pretty sure that most of you have a lot of questions regarding the logistics. So we thank you for the review, for your commitment you've made the last few weeks. So as we mentioned in our email exchange, we ask each individual or organization to commit to several country reviews, and we were asking preferentially 24 reviews, so 24 countries per organization, or 6 reviews, which is about 12 to 18 hours for each individual. UICC have committed to cover the French plans, plus some Spanish and Portuguese, as well as a number of English plans. So we are currently, and we have already done the dispatch of the countries among the reviewers. So you will receive soon. So these reviews have been separately randomized among Group 1 and Group 2 reviewers. Separate emails with a list of countries will be allocated to individuals or organizations. And this assignment and the assignment of plans to team members within a given organization will be done by the organization itself. And non-English plans have been allocated mostly. About the reviews and the material that is needed, you will receive a link to online questionnaire, and each reviewer, as Andre mentioned, will receive also a how-to guide, and that will be this week or by the end of early next week. A link to ICCP and WHO repository will be provided too, with the link, with the dispatch list. So what would be required for the questionnaire will be your email address, your name or the organization you're making the review, the name of the country plan, and a confirmation of a non-disclosure or absence of conflict of interest statements, which means that nobody who has been involved in the review of a plan can't review it actually. So few reminders. You will receive each week or bi-weekly reminders to show the progress of your reviews versus your pledge. So that will boost a bit your work. Statistics about our collective progress will be shared every 2 weeks. So we will see the progress of the overall collaborative work. We still have few requests to partners and reviewers. We still need 1 or 2 persons to be nominated to the review reconciliation working group from January to March. We also need 5 to 6 people to form an analysis group for the period of March to May. So what are the next steps? So there are still gaps into non-English plans. We still need 2 reviewers for either Tajik, Macedonian, Danish, Georgian, Greek, Japanese, Latvian, and Lithuanian, and 1 reviewer for Arabic, Croatian, Korean, and Ukrainian. So you will receive, as I said, an assignment email. So individual reviewers will receive this assignment list corresponding to their commitment following the tutorial. And organization focal points will receive an assignment list to allocate it all across their team following the tutorial. So as we mentioned at the beginning of the webinar is recorded, so we will send you a link to this record so you can catch up and you can also share with your team that couldn't attend the webinar. We will organize early February an additional tutorial which will be similar to this one, and we will also update you regarding the progress and the phase of the review. So last but not least, questions and requests. For any questions, requests, or comments regarding the review process, please send an email to this address, and the email will be active by tomorrow, actually. So thank you for your attention, and please feel free to ask me any question right now. Honored. Thank you. So any question for either Brenda, Andre, or myself? Evangelina?
So if I can repeat sort of in a simplified way to make sure I understood, we will receive an email that will assign us a certain country's reviews to which we will have access, and we will then review it, the country's plans, and then we will have access to those plans to evaluate them based on the 80 points. Is that correct?
Yes.
Okay, great.
So if there are no other additional question, I would like to thank Brenda and Andre for their presentation and Julie for the introduction. And please feel free to send an email and share the link to the recording that we will send you as soon as we can. So thank you, and have a good evening or a good day. Thank you.